Introducing RESTORE2, a deterioration and escalation tool for care homes.
RESTORE2 is designed to support care and nursing homes to recognise physical deterioration in their residents. In this case, the resident was admitted from an acute hospital for respite care following a fall and a chest infection. When a resident first comes in, it's often the case that the home won't know what's normal for them. But in this case, the home did a full set of observations and calculated a news, which was 0, giving them a reference point for what was normal for that person. 2 days after admission, staff and the resident's family noticed small changes with the resident's soft signs. These were subtle and included a slight increase in breathlessness, a decrease in appetite, being more lethargic and looking a bit pale. Ordinarily, these may not be enough to escalate to a GP, but the home did a set of observations and recalculated the news, which was now 3, enabled them to tell a clear story to the GP that the resident might be deteriorating. The out-of-hours service reviewed the resident, but they deteriorated further later that evening. The resident was re-reviewed and this time had a news of 5 that provided clear evidence of deterioration. It also supported a handover between services and the transfer of clear records to the ambulance service and then the hospital. The patient was admitted, treated, and returned back to the care home after a period of time. After a further 2 weeks, they went home. For the staff, the incident highlighted the importance of soft signs and how these changes are an important early indicator of deterioration. The staff in the home also felt that the RESTORE2 tool enhanced their confidence of being able to talk to other health professionals and to communicate their concerns and get the right care at the right time.
RESTORE2 is free to use and is available from the West Hampshire CCG website or NHS Creative. RESTORE2 has been designed to support carers to recognise and respond to physical deterioration. It was co-produced by West Hampshire CCG and Wessex Patient Safety Collaborative. It is free to use in its entirety and must be acknowledged if used as source material for other tools.